Hi, I'm Kim Pearson. I'm a respiratory therapist and I work in outpatient diagnostics in pulmonary rehab. Pulmonary rehab is a supervised exercise program with education for patients with COPD or post-COVID syndrome. Pulmonary rehab will help them learn how to cope with their breathing and how to recover and how to protect themselves. It helps teach them to take control of their disease process instead of the disease controlling them. So when you come into pulmonary rehab, you will come in and you will do a series of warm-ups, weight exercises, and cardio exercises. The warm-ups and the weight exercises are all done in armchairs. So we always warm up the muscles first, and then we do the weighted exercises with anywhere from 1 pound to 5 pound dumbbells, and it's all based upon the patient's ability. Plus we do some chair exercises for the legs too, because those large muscles of the legs require more oxygen. So if we can tone the muscle up and strengthen them, then the oxygen requirement decreases. Part of the weighted exercises is that we want to build up the upper body muscles to make you more efficient in breathing and not have you tire out more, because a lot of patients with respiratory issues tend to use a lot of the upper respiratory muscles, which is up here, and you bring your shoulders up constantly to try to fill your lungs up, and you get tired a lot faster. Your muscles get tired and they start getting weaker and they give out, which causes more problems. And then we move on to cardio exercises, which could be the arm ergometer, or we do a bicycle, and then we have a reclining elliptical, and we have treadmills. Our goal is 30 minutes of cardio, but to pick 3 machines that you feel comfortable on and 10 minutes on each machine. Throughout this whole program of exercising, you will be monitored. Your vital signs will be monitored. We will be watching your oxygen levels. We'll adjust any supplemental oxygen as needed, either up or down, and we will be asking how you're doing, what you're feeling breathing wise, and so we adjust everything to make sure that you're comfortable, and we push you, but we don't push you to excess or to extreme tiredness. And throughout the exercise program, led by an exercise physiologist, I will be doing the pulmonary education about your disease processes, airway clearance, medications, how to prevent infections, how to do recovery when you're having a hard time breathing, all the education to help you have a better quality of life once the program ends. My love of respiratory therapy and pulmonary rehab is to see that the patient gets out of their comfort zone and embraces that new life that they'll be given. Because again, education is power, and when you're educated about your disease process, then you have power over what you can and cannot do from that point on. And that's my big goal, is getting to the patients to be confident in controlling their disease process. I am SLV Health.